Imagine a world where medical students learn anatomy not from textbooks, but directly from the ultimate teacher, the human body. In Northern Ireland, this vision is becoming a reality, and the sheer number of people choosing to donate their bodies to science after death is truly remarkable. Over 1,000 individuals have already made this profound decision, choosing the anatomy lab over a traditional burial. Would you consider letting medics learn from you? This quiet revolution unfolding in Northern Ireland is poised to transform medical education and, ultimately, patient care. Queen's University Belfast has recently revived its body donation program, and the response has been nothing short of extraordinary. With roughly 1,000 people already enrolled and another 250 inquiries under review, the program is exceeding all expectations. This means future doctors will have the invaluable opportunity to learn anatomy through hands-on dissection, a method considered irreplaceable by many medical educators. Why the resurgence of body donation in Northern Ireland? The program faced a temporary setback when new donations were paused during the COVID-19 pandemic. Subsequently, staffing shortages extended this pause into 2023. However, Queen's University Belfast has since taken decisive action, hiring additional technicians and rebuilding its capacity to accept donors. The medical school has now accepted its first donor since reopening, marking a significant milestone. For many new students, this means the dissecting room will once again be a vital part of their education. Queen's University emphasizes that there is simply no true substitute for learning anatomy directly from a human body. While virtual models and digital resources offer valuable supplementary tools, they cannot fully replicate the intricate variation, subtle textures, and overall complexity of the human form. The demand from both donors and students is undeniable. Faculty members report that prospective students, particularly those from overseas, frequently cite the opportunity for dissection as a key factor in their decision to attend Queen's. Here's a quick breakdown of the timeline of events. COVID years. New donations and dissection activities were temporarily suspended. 2023. The pause continued due to persistent staffing shortages. Present. The program has been reopened, the first donor has been accepted, and new technicians have been hired to support the program. Who chooses to donate their body, and why? The motivations behind this selfless act are diverse, but a common thread unites many donors: a practical mindset and a strong desire to contribute to the greater good. One 95-year-old woman from Strangford succinctly explained her decision to her family. If her body can be used to educate future medical professionals, then it retains its value even after death. She also noted that, as she has no close family nearby, making these clear arrangements alleviates the burden on those who will manage her affairs. Others are inspired to donate after conversations with their general practitioner or a medical student. They are driven by a desire to ensure that future clinicians are trained with the utmost care and precision. They also find solace in the idea that their final act will be one of profound usefulness, a lasting contribution to public health within the region. Altruism is a powerful driving force for many donors, who express sentiments such as, "My body won't serve me when I'm gone, but it could potentially help someone else." A foundation of consent and trust. The entire program is built upon the bedrock of informed consent and unwavering trust. In Northern Ireland, body donation programs are rigorously regulated by the Human Tissue Authority. Individuals must formally record their wishes during their lifetime, ensuring that their decision is respected. Upon their passing, their families are responsible for notifying the university. If the body is deemed suitable for donation, it will be used exclusively for teaching, training, or research purposes, adhering to strict ethical guidelines. In most UK-based programs, donors have the option to specify whether they would like their ashes to be returned to a designated individual. Many medical schools assume the financial responsibility for cremation following the completion of the teaching period, which typically extends up to 3 years. This time frame is dictated by the academic calendar and the meticulous care required to preserve and thoroughly examine each body. Technology's role and the enduring importance of real bodies. During the period when the program was temporarily suspended, Queen's University expanded its utilization of cutting-edge 3D models and advanced visualization techniques. These digital tools remain an integral part of the curriculum, providing accurate and valuable resources for introductory teaching. However, faculty members steadfastly maintain that the tactile, three-dimensional reality of dissection is essential for fostering a deep and comprehensive understanding of anatomy in ways that a screen simply cannot replicate. Blood vessels exhibit natural variations, nerves follow intricate pathways, and pathology leaves unique and often subtle traces. Students gain invaluable insights into these nuances through the hands-on experience of dissection. This immersive experience fundamentally shapes future clinical judgment. Doctors learn to navigate unexpected anatomical variations during surgical procedures. They gain first-hand knowledge of how disease alters tissue. They develop the crucial skills of careful and respectful handling of the human body. These habits, cultivated in the anatomy lab, directly translate into improved patient care. How to register and what happens after death. Anyone considering body donation should engage in open and honest conversations with their family members and thoroughly review the university's comprehensive guidance materials. The process typically involves completing a registration form, providing witness consent, and supplying clear contact information so that loved ones can act promptly upon their passing. It's important to note that distance limitations may apply, and a post-mortem examination ordered by a coroner could potentially preclude acceptance. Common reasons for non-acceptance. A legal post-mortem examination ordered by a coroner. Certain infectious diseases or uncontrolled sepsis at the time of death. Major trauma or recent extensive surgery that significantly alters the body's anatomy. Advanced decomposition or substantial delays in notifying the university. Organ retrieval for transplantation. Whole body donation is generally incompatible with organ donation. Some programs may impose limits on body size to ensure safe lifting and storage. It is crucial for families to have a backup funeral plan in place. If the university is unable to accept the body, normal funeral arrangements will proceed. If the body is accepted, the medical school will arrange transportation. Teaching may take place over several academic terms. Once the study period concludes, cremation will be performed, and the ashes will be returned to the designated individual if requested. The ripple effect, impact on medical education and patient care. The reinstatement of full dissection at Queen's University has far-reaching implications that extend beyond the students in white coats. Patients ultimately benefit from the expertise of graduates who have gained a deep understanding of human anatomy through hands-on experience with real human tissue. These students develop a nuanced understanding of anatomical structures, remembering not only where a nerve should be located according to a textbook diagram, but also where it actually lies in relation to surrounding vessels. They also cultivate a sense of humility and respect, in addition to honing their technical skills. The numbers behind the scalpel. The current statistics speak volumes. Approximately 1,000 registered donors, with an additional 250 expressions of interest. The medical school has accepted its first donor since the program's restart, and the incoming cohort of students will have greater access to hands-on anatomical learning. This momentum is crucial. Without donor bodies, significant portions of the curriculum would revert to relying solely on screens and plastic models. Considering donation. Key points to consider. Communicate openly. Talk to your next of kin and clearly communicate your wishes. Designate a recipient. Name a specific person to receive your ashes, if that is your preference. Keep paperwork accessible. Store your paperwork in a location where it can be easily found. Clarify costs. Ask the program to detail which expenses they cover and which remain the responsibility of your family. Understand timeframes and limitations. Clarify the timeframes involved, any distance limitations, and medical conditions that could affect acceptance. Donation and organ transplantation. A crucial distinction. Carefully consider how body donation aligns with your wishes regarding organ or tissue donation. While programs may vary, whole body donation typically cannot follow organ retrieval, as teaching requires an intact body. If your priority is organ transplantation, make that clear. If your primary goal is medical education, ensure that is clearly documented. Both paths can contribute to improving patient outcomes. The choice is entirely yours. Educating others, dispelling misconceptions. If you work in the healthcare or social care sectors, Please share accurate information with families who inquire